Good afternoon, everyone, and welcome to our 8th Community Leaders Update on the COVID-19 virus pandemic. I'm Mike Wilder, and I'm Director of Emergency Management for Danville and Boyle County. And as usual, we have with us today Mayor Mike Perros, Judge Executive Howard Hunt, and our County Health Director, Brent Blevins. You will see a phone number on the front of our briefing. I will give it to you as well. 859-936-6865 to call in and voice your opinion or questions on what's going on, and direct them to either Mayor Perros, Judge Hunt, or Brent, if you would. Of course, quite a bit of information has been disseminated out by the governor's office in the last 24 to 36 hours in reference to turning our possibility to reopening everything up again. Quite a number of things were listed. I've heard some folks that were not happy with the way it was supposed to be doing, some that were, whatever the case may be. That's what the governor laid out yesterday. One of the things that he's saying is that everything's going to be gradual, of course, and he's trying to keep Kentuckians safe from the COVID-19 virus. He unveiled a tentative reopening schedule for a variety of businesses allowed to resume operations. He cautioned that all businesses opening will have to adhere to the 10 rules to reopen. And I think it's worth mentioning those 10 rules right now because they are pretty specific. We'll go through them quickly, and the judge and the mayor may want to elaborate on those or have some comments about them. Continue telework where possible, phased return to work, on-site temperature health checks, universal masks and any other necessary PPE, closed common areas, enforce social distancing, limit face-to-face meetings, sanitizer and hand wash stations, special accommodations, and having a testing plan. And things that are going to be required, as I understand it, to reopen our businesses. And again, it's going to be done on a gradual trend. The list is easily available as to what the dates are. The first ones are at May 11th. Then we go to May 20th. May 20th seems to be one that a lot of people are interested in. That's our retail businesses, and one that we've gotten a lot of chatter about is our houses of worship that will be open provided they meet these requirements on the 20th. Mayor, you're handy there. What's your thoughts?
Well, we were talking just a moment ago that one of the areas that hasn't been addressed, and I think it was agreed that it was omitted, and that is opening up daycares. The younger employees with children have to have some way of putting their children in safe environments so that they can get back to their business and their place of employment. We're getting into a stage where everybody's beleaguered with this. I think it's going to take more resolve on everyone's part to remember that this thing is not over. If you read some of the headlines, the lovely folks in Wuhan, China, are now experiencing a major second wave, and that's something I personally would like for us to avoid. And I think the only way to do it is to continue to be resolved.
Well, that's exactly right. And of course, I've done a little reading about the 1918 Spanish flu pandemic. That's exactly what happened there. They pretty well had that thing under wraps and then let things get out of hand by people going back too quick. And then that's when they got slammed. And we certainly don't want that again because they lost they lost hundreds of thousands of people there. I mean, it was unbelievable, the numbers that they lost in 1918. But again, that's something we have to be aware of. Judge, are you on? Bill, it looks like he's got his sound muted. Does he or not? Yes. Brent, what's your thoughts? What do you got thoughts today?
Well, couple things, just the updates on, we have 18 cases still, and we are down to just 4 of those are active. So that's real positive. And what that means again is that's just people who have worked through their 14-day period and they are now out of that period, and we no longer follow them on a day-to-day basis, and they are back into whatever part of society they were in before. So we're real glad for that. And, you know, out of those cases that we had ongoing, about 4 or 5 of those people were pretty sick. Now, they were not in the hospital, they were at home, but they didn't feel good. And what we discovered is some of those cases would go, the people who didn't feel good, it would be just for a couple of days. But we had a couple of people that this went for 2 to 3 weeks that they just did not feel good at all. And so we're glad those people recovered, and we're glad to be at that point of having 4 active cases. Now, having said that, I agree with the mayor and what everybody else has said. Here's what the key to this will be so that we don't jump back up into a lot of cases. The guidance that's given on how to reopen is extremely important. It has not changed on the social distancing, on the washing hands, using sanitizer as needed. None of that's changed. Matter of fact, to reopen, there's a lot more rules and regs that go along with that we're going to have to enforce. Now, having said that, I also understand we are going to have more cases just from the fact of we're going to be in closer proximity to each other in workplaces, people coming into workplaces. So that's just part of it. So when you see my daily chart that I post, if you see all of a sudden one day we have 5 or 10 cases down the road, you can just know we're getting back to society again, and this is going to be part of the deal. But we want to keep that amount very low. We're fortunate. Ephraim McDowell has been extremely prepared, as well as our other providers in this community. But, you know, even they have a limit, and we never want to even get close to that limit. And I don't think we will, but we want to, let's do our part to make sure we don't. So couple things about that. There's a lot of testing available in this community that's ramping up more and more every day. If that's what you want to do, you can, Ephraim has, I don't know, 4 or 5 sites. Give them a call, that 239-1000 number. Dr. Ravi, I think Dr. Hempel and Dr. Ellis, some others are doing it. So if you need testing, if you feel sick, do that. You know, figure out how to do that. I had a previous question that came into us earlier about the mask deal. And I will say, I've had a lot of phone calls over the last 2 months. I've had a lot of phone calls about masks, probably more than anything recently. So let me address that. And what they wanted to know specifically was when the governor said on May 11th to wear a mask, you know, if there's going to be an enforcement or if there's going to be a fine with that. And there is not going to be a set just police force out there that's locking you up if you don't have a mask on, and not a fine to go with it, at least not that the governor has listed now. But let me say this, I think the enforcement will be more on the social side of people encouraging you to have on a mask if you're going into a big store, in which the stores, they're going to have their own requirements on that anyway, so you won't be able to enter probably without them. But just use common sense about that. You know, I've had a lot of people ask me, hey, do I have to wear a mask if I'm alone by myself in my car? No, you don't have to have your mask on in the car. How about when I'm in my yard mowing? Nope. If you're mowing your yard, no. If you're out back in your yard playing with your kids, if you're out walking and you're social distance away from everybody else, just doing a normal walk, you're fine. What this is really intended to do when we're in businesses, when we get back in church, when we get in settings like that, to help us to not spread that virus so quickly in those large gatherings or even small gatherings like that, particularly when we're struggling with social distancing. That's 6 foot. That's the main design of what we're looking at with this. So wear a mask for a while. Just do it. That's the simple way to do it. You know, when you go outside and you're going to wear that mask. Okay, I also had another question today about how can I eat with a mask on? Okay, it's just the common part of this. You can't eat with your mask on. I get it. You're going to have to pull your mask down to eat. I get it. And that's just how you do it. And I know it gets pretty particular about these type of questions, but just common sense on them as much as we can on that, and certainly catch up with me or any of us, and we'll answer as many questions as we can about masks. But hopefully that gives you a little better guidance on that. I guess probably, you know, looking at the dates, Mike mentioned the May 11th and May 20th. And, you know, when you look at that, the governor is really trying to lay us out a plan on how to get our economy going again, because we need to get our economy going again. We do. And we need to try to get back to functioning the way we want to function. Just be diligent on those dates, and to know that just because it says May 20th is the day maybe my church can open, it doesn't necessarily mean that my church is going to open on the 20th. Or if it's, you know, May 20th or something else you were expecting to open, those businesses can make a decision on whether they open that day, or they might wait it out a little while. So have patience with the businesses as they try to figure this out, because the governor's laid out some pretty strong lines on what they have to do to be able to open. So be patient, but be diligent. The mayor said this earlier. Do not stop doing what we're doing. We've had a good track record so far, and we will have a good track record as we go through this. But it takes all of us continuing to do that on an everyday consistent basis as we work our ways through this. So, okay, that's the majority I have. Did any more questions come in that I missed anywhere on there? Anybody see anything?
No, I think we're good.
Is that it?
Well, I think we're good.
Okay.
Yeah. Judge Hunt, welcome.
Well, sorry, I had some technical difficulty with my computer not wanting to connect to the internet or something. I don't know, so I had to reboot and carry on. But I'm here. I'm sorry I missed what I've missed, but I have full faith and confidence and trust in you guys to have done an excellent job so far to this point. We got about let's see, about I don't know, 15 minutes or so left. I've been talking to several judge executives today across the state, and there is I will say that there is a bit of frustration that maybe there's a little disappointment in the reopening schedule as presented, and where I see a lot of frustration is coming from those border counties like Simpson, like Boone, Campbell, Kenton, because the states of Ohio and Cincinnati are opening now, or already have opened in Tennessee, and those residents are going out of state to eat at a restaurant and different things like that. What I would like to ask, if for those who are watching this presentation, I would like for you to consider emailing me your ideas on reopening, what it may be personally doing to your business. I'm aware of some of the stresses and strains throughout this county on different places, and I would really like to know what that impact is. And you can email me at hunt@boyleky.com, or feel free to call my office and leave a message, or to give us some information. I'm sensitive. I really think, you know, what I've witnessed on TV, whether you like him or not, or think he's doing a good job or not, the president in his COVID-19 reopening consulted everybody he had access to, and then he turned to the governors who are closest to the to the states that know where, when, and how that they can do it best. That was a good move on his part. I would like for, it just stands to logical reason, and that maybe the governor should look to the county judge execs and the mayors to know what's best for where they are, where the rubber meets the road, to allow them. It might not be right for Jefferson or Fayette or Franklin, but it might be right for Anderson or Boyle or Mercer or something like that. And it's just something we need to consider and look at. And there are some people, I'll be honest with you, and I've heard from them, business people, that may not be able to make it to the 25th of May without some kind of resolution to opening. There may not be anything left to open on the 25th of May. And I'm just telling you what I've heard straight up. I would like to know from the every element of this business community in the county what they think about the reopening schedule and how they might be able to advise on something that we could float up to the governor for consideration.
I agree. I've heard the same comments in the last 24 hours as well, Judge, about the folks. I had a business person call me last night, and she was very concerned about being able to survive till the 25th. She said, I got bills to pay, and small business, and she just goes week to week, and it's just very difficult when she's already been off and closed for 6 weeks now. Very tough. It's tough. I feel for them.
It is tough. It is tough. And I'm opening myself up to be more receptive to those businesses throughout this county. I would like to hear from you and give me some ideas on how to articulate a safe opening as it impacts, particularly designed for Boyle County. I would love to know all the information I can know about it. And I'm sure Mayor Perros would too. A lot of industries are in the city. A lot of businesses are in the city. I'm not saying anything. I'm not going to speak for him, but I know that he senses the frustration from the people like I do.
Oh yeah. Oh yeah.
So I just want to make that.
Mayor?
I totally agree with the judge. Before you got on, one of the things I mentioned in the reopening, which the governor has failed to even mention at all, is about daycare centers. Until you get these daycare centers open, these younger employees with children, they're stuck. They're in a corner. You've got to open up the daycares to give these young employers and employees some safe place to put their children during work hours. So, but I do agree with you. And as much as you can do, Judge, because they're not going to listen to us mayors, but they'll listen to you judges. And as much as you can do, please do.
Well, I'm not saying I'm going to upset the whole apple cart, but I'm looking for options and alternatives to help a best practices reopening that can serve everybody safely. And I'm not, I just think, Brent, I value your opinion and extremely highly. And I would not recommend doing anything that would jeopardize lives in a collective opinion. But there might be things that we are missing, or we're missing from Frankfurt, that we can do better.
Oh, absolutely. I agree with you 100%. I think any kind of new ideas, and I tell you where I've been really pretty fascinated. A lot of the churches have called me in the last couple of days because now they see a date, and just some of the different ideas they have on how they're going to open, what that looks like within their building. It's pretty amazing when people start thinking through different solutions. So yeah, I would always be open to hearing other ideas, what it can be and how we can pair that maybe with what the governor's doing and see where we can get. And I think it's a great function of this community that people can talk to our judge executive and our mayor both and be able to say, hey, here's some concerns, here's some ideas I've got, and have a place to do those. So I do think that's great. I think that's probably the best two places for that to be, because honestly, a lot of my role the last 2 months on the business side, unfortunately, has been more on the enforcement side. And I've obviously had help on that. It hadn't been just me or anything, but it seems like that's where I've spent a lot of my time, having to tell people what they can't do, as opposed to being able to give them the option to say, hey, here's a different way of looking at that on what we can do coming up pretty quick. So I think that's a great idea. And hey, Mayor, I just got a text back from the state on the daycare question, and they didn't know the answer, but Dr. White is going to check on that, and she will let me know, hopefully in the next day or so, what they're thinking, and I'll get that information out.
Thank you, Brent. No doubt you're a man of action. I appreciate that.
No problem.
He has connections, Mayor. He has connections.
I've had to use a few of them during this thing. I tell you what, I've learned a lot.
I think we've all learned a lot, and I'm not saying we're all better for it, but we've learned a lot. And I just want to, I genuinely, in the bottom of my heart, want all Boyle Counties, Danvillians to contact me, 238-1100 or HHUNT@boyleky.com. Give me your ideas of how it's impacted you and how you can make a recommendation to improve your work environment safely and securely.
Brent, you got anything else?
Probably the last thing I would encourage people, we get a lot of calls for people looking for PPE, which includes masks, and mostly it's what people are looking for, and particularly businesses, because that's part of those requirements. There are now local agencies who are selling masks, who are getting those in, as well as maybe some hand sanitizer, gloves, those type of things. So don't feel like you always just have to find that on an online place from somewhere else. Check our local businesses. I've had a couple of them already email me in the last couple of days saying, hey, we've got this in or we've got that in. So definitely check out our local people too first if you can. You might be able to get it here and literally get it that day or the next day and help out a local business as well as yourself.
One thing that I want to bring to attention, and kind of want to leave it at the last point that we do today, is talking to our EMS director, Mike Rogers, yesterday at great length. He sees a little trend that is beginning that concerns him, and I think it should concern everybody in the county for that matter. They're seeing a lot of folks that are sick and not going to the doctor and not going to the hospital or the ER. And that's something that we need to nip in the bud quite a bit real quick, because it's simply, we could lose some lives over that. And they've already had a couple of instances where I think there's been some fairly sick people that didn't go to the doctor or to the ER because they were afraid to. And they're afraid of the virus is what they're afraid of. And we had the hospital this morning, Brent, we talked about it as well. And they assured everybody on that call that there's no reason for any fear. The hospital is safe. It's as sterile as any place you can imagine. And if you're sick, you need to go to the hospital. You go. We hear a lot about don't go unless you have to go. Well, there's a lot of people that have trouble meeting that threshold. Do they need to go or do they not need to go? If you're sick, you need to go to the doctor. You need to seek medical attention. And I know Mike Rogers had asked me to make mention of that today, if I could, that don't be afraid to call somebody.
Absolutely.
We need to get the word out as much as we can.
Absolutely. And hopefully by this past Monday, where they started opening up those other healthcare related businesses, hopefully that will help people in the public reestablish that confidence quickly on going back to those services.
Right.
Oh, good.
Judge, you got anything else?
No, I just want, again, please contact my office with innovative recommendations. And I want to hear your stories. I ask that everybody remain vigilant and stay safe. We're one day closer to being out of this. And I want to hear from you, and I will present valid. I will present all of these arguments or discussions or information to a higher authorities to see what we can do. But I want to discuss it locally amongst the community leaders in this county to make sure that there is solid, viable reasoning behind some of these innovative approaches that I hope that we hear about. Thank you.
You know, if I was in Frankfurt in the governor's chair, just like we're sitting here today, I believe I'd welcome anything that anybody had that would make my job just a little bit easier.
I agree.
Hopefully that's what they'll do as well.
Sorry I was late.
Anything else from anybody? Not a problem.
Not me.
As far as we're concerned, we will meet again, same time, same place, 3:30 next Thursday afternoon. So if any need arises that we need to try to get on earlier or do anything differently, we'll try to get the word out as much as we can. Thank everyone for being here. Thank you guys for being on.
Thank you.
Sure.